SickKids experts say that school closures should be the last resort when it comes to the pandemic response. In a new report today, they released updated recommendations on how to safely reopen schools. This is the third time they've released this document, and this time there is an emphasis on a robust testing strategy. Schools should be the last to close and the first to open during this health crisis. That's according to a new SickKids document noting school closures have resulted in increased rates of depression and anxiety, substance use and addiction, and suicidal behavior among children and youth.
I think our children are the somewhat unheard voices of this pandemic.
The latest report says expanded testing is critical to reopening schools safely.
We really have not had a robust testing strategy in place.
The recommended strategy is to test all symptomatic students in the province and all exposed students, even if they're asymptomatic. Large-scale surveillance testing is only being recommended in areas with high community transmission or in schools with outbreaks, because routine testing of asymptomatic students is not feasible.
We don't have the resources to be able to test every single day all 2 million Ontario students. It needs to be a lot more targeted versus just simply, we're going to test all of York Region and every single school. We should be focusing our resources on areas where we're likely to find COVID-19.
The report also notes the identification of cases through surveillance testing is expected and shouldn't by itself be a reason to close schools. The other major change being recommended is to prioritize cohorting rather than the strict enforcement of physical distancing, especially for younger students. Smaller cohorts are also beneficial. In model simulations where a class of 30 was broken down into 2 cohorts of 15, there were significant benefits in terms of reductions in the range of possible outbreak sizes observed and student days missed. Experts do note Ontario's numbers have improved since lockdown was implemented and learning was moved online 4 weeks ago.
So not only have our cases plateaued, they've actually gone further than that. They're actually dropping now here in Ontario. We need to strike a balance.
We did ask the Ministry of Education about the report, and they tell us they are following the guidance that is recommended in the report. They say they are increasing infection prevention measures by enhancing Canada's masking protocols to include grades 1 to 3, expanding access to targeted surveillance testing, stricter screening protocols, along with ventilation improvements. These are all measures that were suggested in the SickKids report.